because we come from a situation in which we've had a separate and unequal system of care for people with illnesses, right? Think of the asylum movement, even the community mental health centers movement. It was a system of care for people that was not integrated with the overall healthcare system typically, right? Some would argue that we continue to run systems that really kind of look like state hospitals in many ways, and not the best work that state hospitals can do. Increasingly, we're realizing, both by the fact that people with severe mental illnesses have an average life expectancy, served in public mental health systems, have an average life expectancy of 55 years. They're dying 25 years earlier than you would expect them to die, and they're dying from heart disease, from the long-term consequences of diabetes, from hypertension. They're dying from the same thing that's going to kill all of us, but they're dying in their 50s. So they have a life expectancy of someone in Bangladesh, right? So we realize that something's got to happen to get better medical care for people who are most vulnerable, who traditionally really concentrated on. But perhaps even more importantly, we realize that the general healthcare system is where most people with mental illnesses show up. And we've got to do a much better job of integrating care for them. Fortunately, our science base is good. The issue is, how do we get there? So we have an insurance benefit now that will continue to grow, we hope, in the exchanges and as the Affordable Care Act takes hold. We certainly have a science base. I'm going to talk with you a little bit about that in terms of knowing what we should be doing. And we're kind of at today's presentation, in some sense, is kind of a riddle. And that is, okay, we know these things, and I'll show you several of the things that we know. How do we move into a greater state of action? And of course, that's one of the important things that advocacy organizations do, is to try to take our scientific knowledge. I think it's hot. Since I'm being videotaped, I don't want to look like I'm perspiring. Thanks. So how do we sort of so I want you to join with me in thinking about this and trying to figure out how we get where we need to get, given the scientific knowledge that we have, and this realization that we need much more holistic, integrated approaches to healthcare than we've had in the past. And you'll see that the problems we're facing are not that different from the problems in general medical practice. And anybody who's ever had to go into the hospital themselves or had a relative go into the hospital realize that you really need a case manager of some sort, right? Because the cardiologist isn't talking to the nephrologist, the heart guy isn't talking to the kidney guy. Neither one of them are really talking to the primary care physician who's supposedly coordinating the care. And of course, we have exactly the same problem in mental health conditions. So it's a good general riddle. Today we're going to talk about an approach that looks at the use of trying to create what we call demand-side push for improvement. What can we do to try to get employers, purchasers, to be smarter in terms of their purchasing decisions, to start to drive the insurance industry to provide more competent levels of care. I'm going to show you